Hi, I'm Dr. Vijay, Medical Director of Bio Aesthetic. Today we'll talk about HIFU. HIFU stands for High Intensity Focus Ultrasound. So what is HIFU? Basically, right, as we advance in age, we lose collagen. After 30 years, every year we lose about 1 to 2% of the collagen, and after 40 years, the collagen loss gets accelerated. So what happens when we lose collagen? The skin loses its tightness and elasticity. As a result, the face gets saggy. So what this HIFU does? HIFU would help to restore the collagen that we lost. HIFU would help to tighten your skin by building the collagen. So there is a layer in your skin that's called SMAS layer. This layer is like a supporting structure for your skin. And when this SMAS layer loses the collagen, the skin sags. What essentially HIFU does is it helps to build collagen in the SMAS layer. So in someone with a good result, you can even see a little bit of lifted effect up to like 0.5 cm lift. But in good number of patients, we don't see this kind of lifting effect, but in those kind of patients, it will prevent their skin from sagging down. The HIFU, we use two type of cartridges. One is dotted cartridge, the other one is linear cartridge. The dotted cartridge is mainly for skin tightening effect, building collagen, whereas in terms of the linear cartridge, it is more of helping to target your fat cells. So someone with a mild to moderate amount of double chin, the fat accumulating under your jaw, we would be using the linear cartridge to target their fat cells. And once the fat cells have been addressed, and if the skin is still a bit loose, we can always do the dotted cartridge as well to tighten your skin at a later date. Obviously, the HIFU is not an instant result. After we do HIFU, it takes about at least a month before we start see the changes. And the collagen building process is a slow process. And at 6 months, we have a peak result. And about 6 to 9 months, we need to do maintenance to maintain the lifted effect. In terms of the side effects, right? Any energy device we use, there is always a risk of causing a skin burns, blister, and scarring. But with HIFU, it's actually very, very rare to cause a skin burn, blister, or scarring. Heat rashes can happen, which is like hives kind of thing on the skin, but this thing will usually disappear within few hours, sometimes a little bit longer. The redness of the skin can happen, which usually disappears in few hours as well. If anyone has a saggy skin, and the skin does not have elasticity, and you don't have a bouncy skin, age-related sagginess of your skin, feel free to drop by. We would assess your skin and potentially do HIFU for you.